According to Statistics Canada, more Canadian children are dying and more Canadians under the age of 45 are dying after lockdowns and vaccine mandates were imposed on Canadians. According to Statistics Canada, the death rate for children ages 1 to 14 in 2022 and 2023 was 15% higher than during the years before lockdowns. These are not COVID deaths. According to Statistics Canada, after lockdowns were imposed, drug overdose deaths rose by 55%, and they have stayed at that new high level after lockdowns were imposed. According to Stats Canada, 18% increase in alcohol-induced deaths. And according to Statistics Canada, 15% of younger Canadians under the age of 45, 15% are dying of unknown cause. So in 2022, 3 years ago, 15% of Canadians who died, cause of death is listed as unknown. According to Statistics Canada, the number of Canadians dying of COVID actually increased after the vast majority of Canadians got injected with COVID vaccine and booster shots. Pre-vaccine, COVID deaths were 16,000, and then in 2022, after vaccines had been taken by most Canadians, especially elderly Canadians, the death rate jumped to 20,000 people dying of COVID. Makes you wonder how effective are these vaccines when the COVID death numbers go up after everybody's been vaccinated. Statistics Canada data tells us that lockdowns killed many Canadians, that the vaccine was not as effective as claimed, and that the vaccine may have been harmful to many. All of this is laid out in a new Justice Centre report titled Post-COVID Canada, The Rise in Unexpected Death. Some people will be very upset with this report because it undermines the government narrative and the media narrative about COVID, about lockdowns, and about the vaccine passports. But it's not the Justice Centre coming out with this data about rising deaths in Canada after lockdowns and vaccine passports. It's Statistics Canada that is giving us these numbers. Canadian politicians and government health officials should take note. They should be interested. They should be looking at this data, and they should be trying to answer the difficult questions that it raises. I'm John Carpay. Thanks for listening.